Hello, everybody, and welcome to this, our last knowledge exchange of the fall semester. Our showcase for posters will be coming up December 6th, but we're really excited about this presentation today on promoting relationship resiliency in patient-client care. I think we're all really ready for something like this right now. This is a collaboration between the Center to Advance Interprofessional Education and Practice and UNE College of Osteopathic Medicine and Southern Maine Health. So it's a lovely collaboration. And our question to you today is, do you feel ready and resilient enough to partner with patients and clients while delivering quality interprofessional collaborative care? Well, today, hopefully you'll get some great ideas and some tools to make that happen, and assert the importance of relationship in your practice. So I am delighted to introduce Stephanie Gray from Southern Maine Healthcare. Stephanie, take it away.
All right. Well, welcome everybody. I'm so glad that we have so many people here today. All right. So I'm going to hand it over to Stacy to introduce herself, Dr. Pierce-Talsma, one of your own here from UNE. So Stacy.
Hi, I'm Stacy Pierce-Talsma, and I'm the Associate Dean of Academic Affairs here at the College of Osteopathic Medicine.
All right. And as for myself, Stephanie Gray, I'm a PA. I'm also the Director of Provider Wellness, Engagement, and Peer Support at Southern Maine Healthcare. My function is to create and refine systems so that we can prevent burnout and provide the best quality care to our patients that we possibly can. Disclosures? We don't. I wish we do, but we don't. We hope to someday. So the learning objectives, literally just as Shelley stated, we want to talk about burnout, we want to talk about resiliency, and we want to talk about relationships and how that impacts how all of those things interrelate to provide great patient care. At this point, I'm going to hand it off to Stacy to lead us through a breathing exercise. Stacy?
Thanks, Stephanie. We thought it would be a great idea to start by getting grounded and practicing some tools that can really help you to enable your own resiliency. So I hope that you're able to find a comfortable seat wherever you are, maybe placing your feet flat on the floor, feeling a little bit of connection to the ground. And if you feel comfortable, you can close your eyes, or you can kind of just look soft and unfocused at the space in front of you, whatever feels comfortable to you. And what we want to do is start with some lengthening exhales. So this really works to engage your parasympathetic nervous system, the rest and digest nerve signals. By breathing slowly and smoothly through our noses, we tap into our body's ability to quiet and to center. If you feel any discomfort at any point during this practice, during the breathing practice, simply return to your normal breath. So as a practice, what we'll do is we'll inhale for a count of 3, which I'll count out for you, and then we'll exhale for a count of 6, which is simply slowing the rate of air flowing out of your nostrils. So if we could all take a breath together, a simple inhale in, and then exhale all of your air out through your nose, we'll begin. Inhaling for 1, 2, 3. Exhale for 1, 2, 3, 4, 5, 6. Inhale 1, 2, 3. Exhale for 1, 2, 3, 4, 5, 6. Inhale 1, 2, 3. Exhale 1, 2, 3, 4, 5, 6. Last one. Inhale 1, 2, 3. Exhale 1, 2, 3, 4, 5, 6. And then return to your normal breath. Take a moment with your eyes closed or gently unfocused in front of you to feel any sensations that this short breathing practice enabled you to experience in this short minute. And if your eyes were closed, you may gently reopen them. The second breathing technique we'll do just once. It's called the physiologic sigh, and there's actually really good data that it's very, very calming to our nervous system. So I'll show you what it is first. Again, it's breathing through the nose, and it's an inhale, and then it's another inhale on top of that without breathing out. And then it's a long, smooth exhale. So let's go ahead and do that together. So go ahead and breathe in. Good. And you can always do that breath for several rounds for added benefit. So I hope this helps you feel a little bit more grounded and centered. And with that, I'll turn it back over to Stephanie.
Thank you, Stacy. So in part one, we really want to address the idea of burnout. Burnout is pretty significant across all professions, but it's intensified in healthcare professions. So what we'd like you to do is go ahead and use this poll everywhere to put in one word that you associate with burnout when you think about that. I'd just like to go over a few statistics as to why this is so important. There have been numerous studies done in the past years, even before COVID, but certainly during and after COVID, to ascertain how much burnout we have in our healthcare professions. And the most recent study concluded with this particular quote. I hate reading things off slides, but there it is. I have little joy in performing the job that I believe I was born to do. Now, not only am I tired of work, I'm tired of life. And it doesn't take much of a leap to understand how this can affect our patients and the type of care that we deliver. And this is not just doctors. This is not just nurses. 54.1% of clinical professionals across all spectrums in a recent survey reported one or more symptoms of burnout. Our nurses really are struggling. 56% of them are reporting burnout in their daily lives. 79% of respiratory therapists. I didn't see any of those actually come on. I'm sorry if I missed you in the chat, but that's a lot. You would expect that in 2021 with COVID, but it hasn't gotten much easier because COVID's not gone, suppressed but not gone. 1 in 10 physicians considered suicide in 2022, according to a survey. And the prevalence of burnout in medical students, even before we get to practicing medicine, is 37.2%. Exhaustion, stress, overworked. It's incredible feedback, incredible feedback. One of the things to understand about burnout and why Dr. Pierce-Talsma and I are so passionate about resiliency is burnout isn't just being tired, right? And you invariably are tired when you're burned out. But you would expect to be tired after a marathon. You would be expected to be tired after boards. What we experience in burnout is more the everyday accumulation of microaggressions as we're trying to practice our medicine and practice in our lives. And that can be, I'm supposed to be able to bill and code all of these things. I get coding orders and I don't have the support to do that. It could be, I have no autonomy over my schedule. There's always one more. It could be, I don't get to eat, I don't get to drink, I don't get to exercise, and yet I'm still supposed to have something left over for my patients at the end of the day. And that's where burnout comes into play. And honestly, depression, some people will experience that. Depression could be underlying. It can also be a result. But really, burnout has more to do with PTSD than it does with any other mental health illness. It is that chronic experience of cognitive dissonance over time. And we actually do treat it when we're treating burnout in much the same way as we would treat a war survivor or somebody from the military services. So with that, we'd like to go into the first breakout, creating a safe space as always. We want to talk about burnout. We want to know about your profession, how you define it, whether you're experiencing it now. Remember, there was a statistic that said 37.2% of medical students define themselves as burnt out. And then in your groups, we'd like for you to prepare one statement, just one word synopsis that everybody can agree on that best summarizes your discussion.
And
Our group
one.
really spoke to the loss of empathy, that's kind of the first thing to go, is an ability to, you're so burnt out yourself, you're so exhausted yourself, that to empathize is really tough.
All right. So moving from burnout into relationships. Great. So we were just talking about burnout, and we want to link it to building relationships in healthcare and why that's important. And how do these two things actually influence each other? So let's start by defining relationship. What is relationship? So if you look up a definition of what relationship is, it's the way two or more concepts, objects, or people are connected, or the state of being connected. And as humans, relationships are so important. We have very good data that shows that loneliness and social isolation increase all-cause mortality, comparable to the risks of smoking and alcohol abuse, and worse than obesity and high blood pressure. Think about that. When you go to the doctor's always looking at whether you have high blood pressure, what your heart rate is, but are they ever asking you, are you lonely, or do you have good social connections? And do we need to be asking about that? Loneliness and social isolation can cause earlier decline in functional status and puts us at more risk for infections. In fact, the World Health Organization considers social support networks to be a vital determinant of health. Being lonely is stressful to our bodies. We release cortisol and our bodies turn on inflammation cascades, and we actually go into fight or flight. In osteopathic medicine, we talk about the interconnection of mind, body, spirit, and how we try to look at the whole of the person. And within the context of the whole person is who we are, is how we bring ourselves to the healthcare experience. So through relationship, connection, and compassion, it's been demonstrated that our relationship with patients can actually decrease the need for opiate pain medication, decrease the patient's respiratory rate and heart rate, while also improving heart rate variability and lowering blood pressure. When comparing high compassion providers to low compassion providers, high compassion providers had an 80% higher likelihood of having patients with optimal blood glucose, cholesterol, and a 41% lower odds of diabetes complication. A therapist's compassion has a moderate to large effect on reducing depression. The way in which we connect to others is very important. So in the book Compassionomics by Tresiak and Marizzelli, it's been found that people are becoming significantly more self-focused and less others-focused, and that's really been accelerating over time. There's been a sharp decline in empathy, and burnout, as we just talked about, is rampant. And when these things are combined together, we miss patient emotional cues and those moments when we can respond with compassion and develop that relationship. And research shows that this is happening 60 to 90% of the time in patient and provider relationships. Also, lack of relationship or even depersonalization harms patients, leading to increased medical errors and poor patient outcomes. And in our clinical care, physical harms are tracked, but emotional harms are not. So how does our lack of relationship impact future healthcare encounters and outcomes? But we can make an impact by developing relationship through showing compassion. And outcomes when we do that show increased adherence to medical treatment plans and patients being better engaged in their own self-care. It also improves our patient-centered communication and patient enablement, allowing a patient to feel empowered after a clinical encounter. We just reflected on all the things that lead to burnout, but what if relationships are actually the cure? In healthcare, not only do we have relationships with our patients or with our clients, but we also have our relationships with each other in interprofessional care to support the health and wellness of each person. Our ability to work in relationship is our ability to work in teams. And like any good relationship, good teamwork takes relationship building, and teamwork really develops through training, like the things that you guys are doing, working together. It takes joint reflection and it takes clinical debriefing. And as you can see on the slide, in a meta-analysis, teamwork has proven a medium-sized effect on clinical performance. And this effect is not to be underestimated. Teams who engage in teamwork processes are about 2.8 times more likely to achieve high performance than teams who are not. So looking at performance measures in the study, we see this either describes patient outcomes like morbidity and mortality, and are closely related to those patient outcomes, things like adhering to treatment guidelines. So our teamwork, our relationship, how we work together is actually really powerful medicine. When we work together, we have improved access to healthcare, resource utilization, patient safety, and healthcare outcomes. When we create a culture of that connection, relationship, and compassion, it also affects us with better employee outcomes, lower emotional exhaustion, and better work experiences. So in the care of patients and clients, we're often taught to avoid burnout, that we need to back up, that we need to distance ourselves. And we certainly need to have good boundaries. I'm not saying that. But what we're finding in literature is the more connection that we create, the more that we lean into compassionate care, the more that we develop relationship, the more it helps us as providers, as caretakers. We have less depression and anxiety. It builds positive emotional reserves, and it actually protects us from burnout. So, thinking about all of that, we'd like to move into our next breakout, which is going to be about relationships. So for our discussion, what are the barriers to developing relationships in healthcare? And how can relationships help us to avoid burnout? What skills are needed to better build relationships? And then we'll work one more time to prepare a takeaway that you can drop in the chat when you return.
Mahal, about empathy and the system. I agree with you 100%, and that's why I have my job. And there is a huge amount of work being done right now surrounding how do we make the system not tear apart the relationships and not contribute to the burnout cycle. Wyatt, yes, communication and prioritizing the time you need. That was something that we talked about in our group, and that, you know, taking the time and investing in time for a relationship is as much a habit as anything else. And if you have that habit, it's easier to do. Good communication, absolutely. Cannot be overestimated or overstated. Empathy is critical, and sometimes it's hard to have that, but being able to go back and recenter yourself to the work that you need to do in the moment is more than helpful. Right, resilience. Another poll. Yeah, I love polls. You'll have to forgive me, or maybe you won't. But how do you guys define resilience? And I'd like to use poll everywhere for that. Strong. Absolutely. Grit, unwavering, unbroken. I love it. Perseverance, tenaciousness. I hope all this is like available in a larger format when we're done, because I want this for my wall. What do you think, Stace?
I love it.
Grit, a lot of grit in there. And may I just say, my dogs have been out in the mud, and there's a lot of grit in my bed too. Just as we're accumulating answers here. Elasticity and flexibility. Perseverance. I love humor. Humor. Oh my gosh. Gallows humor, regular humor, potty humor, wherever you need to find humor as you're going through your healthcare careers. Absolutely. So true. Adaptive. Very much so. Very much so. Survivor. I love it. Clearly, there's a lot of thought that's gone into this. So let's move on to what we did. So Dr. Pierce tells me, I strongly believe in resiliency. And one of the things in my role is, yes, we're trying to change the systems to be more healthcare provider friendly, more healthcare team friendly, but we're not there yet. So what do we do? What can we provide our healthcare professionals so that they can get through the interim? How do we get ahead of this tide? So Dr. Pierce Talsma and I'm going to start calling you SPT because I can't do the hyphenate anymore. I just can't, Stacy.
Everyone else does.
So got together and said, okay, let's start employing resiliency in a learning program. And we started with the third year medical students from Unicom. And we have a cohort of 8 that rotate through. And the resiliency content is really designed to build on foundational aspects of what resilience can look like as you start practicing. So that's that first year you're really starting to get your clinical chops, if you will. We meet weekly, or at least we meet once a rotation, and there are other didactics we have weekly. But we talk about these things, and we start with the 3 pillars, we call them: self-inquiry, relationship building, and self-care. All right. So relationship, self-inquiry is knowing yourself, understanding your biases, understanding your needs, and understanding your lenses, because that's going to affect how you actually approach your patients. Relationship building, communication skills were critical, according to our research and our students. How do you have those hard conversations? How do you keep your patient engaged? How do you receive and react to feedback? And then finally, self-care. Despite all of our best efforts, things are going to go south every once in a while. And so how do we take care of ourselves, optimize ourselves, and recenter ourselves when we're losing control of everything that's going on around us? So really our goal was to develop really resilient, reflective third-year medical students who can then go into their 4th year in their residency with a few more tools in their toolkits as they begin to practice in the healthcare setting. Here's our syllabus. And, what we did is we provided reading materials, some of which we emphasize, portions of which we really emphasize. The first thing we started with was feedback and crucial conversations, because that's what our students said we really needed. How do we talk with our patients about things they don't want to talk about? How do we talk about things with our preceptors that we don't know how to approach? Then it was about knowing yourself, knowing what you're really great at and how you function in a team. And then how do you take that and translate that into productivity? And what are maybe some of those things that are holding us back a little bit? Maybe your imposter syndrome is something that's holding you back. And then how to explore that as actually a secret weapon that's working for you. And then how to preserve the things that you need in your life to keep you from getting to that state of burnout. How to preserve and make those habits that are going to keep you focused and available for your patients. So for our breakout 3, we want to talk about resilience. And we want to know, what are you doing? What is your personal approach to resilience? What is your program helping you do to have resilience? And how does that resilience, taking that moment, engaging in those practices, allow you to build relationships with each other and with your patients?
Building resilience, good attitudes, leading by example. I like that one. You can help the people around you to be more resilient as well. Being there for them. My group talked a lot about relationships and the importance of leaning on peers and leaning on people within teams, bonds, definitely, to build resiliency together.
My team talked a lot about nature and about literally just escaping whatever place that they were in for just a moment or 5 minutes or 10 minutes and getting back to nature, and how important that was. So
lots of great psychological health benefits from being outside in nature and looking up at the trees and seeing green. Great evidence on that. All right. Well, we will go ahead and move into our conclusion. So in the program that Stephanie and I worked on, we did gather some feedback and some data from the students who were in the program. And what the students really felt that they agreed with was the session provided me with information to grow and learn as a third-year medical student, that they plan to apply lessons learned from the session, and that the sessions contributed to learning and advancing in resiliency. And so, I think sometimes the concern when putting programs like that together is students really want to be focused on the medicine. They have so much to learn. They have so much to learn about board. They want to pass boards. They want to pass COMATs. They want to get good residency programs, but that this was really valuable, that this helped them when they were on their rotations. It helped them with feedback. It helped them understand patients. It helped them understand working with their various preceptors. And so that was really valuable feedback for us to say that this is really useful for our students. So some of the things that they said in their quotes, the most valuable thing that they learned was being curious about feedback. Sometimes accepting feedback can be really challenging, right? It can, we can have a growth mindset and learn and grow from it, or we can have it really take us down a notch, which can be really disappointing. But developing the ability to get curious about feedback, to have that growth mindset, to develop and take charge of your own growth is a way to promote resiliency. Other students thought how important it was to think proactively about critical conversations. So before one of those critical conversations happens, either with a preceptor or with a patient, stop and think about it. Think about what your feelings are about it and what you're bringing to the conversation. And remember that patient is a person who has a full and complex life as well. And what might they be thinking about it? And how are you going to find that out? And how can you bring that compassion and that empathy into that relationship? Students thought about patterns that lead to unfavorable mindsets. I heard in some of the breakout groups, we talked a lot about venting, and venting can definitely be supportive, but there is that point where it kind of turns over and it's just constant critique, right? And our minds are always challenged and always looking for the negative. I forget what the actual ratio is, but I think it's like 4-1. You have to think 4 positive thoughts to counteract 1 negative one. And so when we have these mindsets that are constantly looking for the negative, we're going to find it more often versus facilitating ourselves to be able to think about what are the positives so that we can see that more often as well. How to change our framework, perspective on what is failure and actually turn it into a positive. We learn the most when we fail. We learn from where we need growth. And it's only when we push into those places that we have the best learning. And then it really helped me to understand the way I speak to myself, the way I think about myself, why I feel certain ways, and better understand myself as a student and future physician. And this might be my favorite quote because it's really shows the reflective capacity about doing some of this learning, and how when you understand yourself, it allows you to better understand where your patients might be coming from as well. So I want to leave you with a final thought, which is from the book Compassionomics, and they really talk about the power of 40 seconds. So many care providers do not feel that they have enough time to treat people with compassion and really develop that relationship and move towards more connection. There was a study at Johns Hopkins Oncology Department, and they studied an enhanced compassion intervention. And what did they find? The time actually only took 40 seconds. They had a statement at the beginning of the consultation, which was, "I know this is a tough experience to go through, and I want you to know that I am here with you. Some of the things that I say to you today may be difficult for you to understand. So I want you to feel comfortable in stopping me if something I say is confusing or if it doesn't make sense. We are here together and we will go through this together." And then at the end of the consultation, they had another statement that they said, which is, "I know this is a tough time for you, and I want to empathize again that we're in this together, and I'll be with you each step of the day." Just let those words kind of sit with you for a moment, and imagine if your provider said those words to you, how much better supported you might feel, how much more of a connection you might feel like you had with that provider, and how much you might feel more empowered in your own healthcare. So they found that these statements in this research really lessened emotional distress, and that the effects lasted up to 6 months. So it wasn't just at the encounter, and it wasn't just a week later. They really found that people still felt this connection 6 months later, which is so incredibly powerful, that only 40 seconds of compassion, of relationship building, can have such a profound effect on the total health and well-being of your patients. So the last poll, what area of resilience training would be most helpful to you?
That's pretty impressive, Stace. I'm sorry, Dr. SPT. She's Stacy to me.
We also like when to grit and when to quit. We chose, you'll see at the end what books we chose. There's 2 books, and really gritting and quitting are 2 sides of the same coin.
Absolutely. Absolutely. And sort of just to illustrate as we're pulling things in, what Dr. SPT had to say, I have a patient who's now been in the hospital for 100 days. And that's a really long time to be in the hospital when you're relatively well, because he has just so many social problems. And I generally get these difficult patients after they've already been here for 30 days. And where I start each of my conversations is, I know this has been hard. We're here to work together to find the best way and the safest way to get you to another place. And I lead with that and I stop. And this one person in particular came in florid failure, and is now 100 pounds lighter for his experience, completely off all drugs and alcohol, and is finding a better place for himself, and says he's finally in the place where he feels like he can start his life over again. And that's from that one conversation. And I only see these folks once a week. So that's how powerful that concept actually is.
All right. Well, at this point, we would really like to open it up to questions and discussion. And thank you for all of your thoughtful participation in the breakout rooms, and maybe bring some of that energy and some of those ideas to a discussion here.
Well, I know we don't have any questions right this moment, but I just want to say that the statement of it only takes 40 seconds really is powerful, because what I heard over and over again, we just don't have time. We're really pressed. And that wasn't only in the clinical setting, but in the classroom as well. And so that research has been replicated in other places, that it doesn't take much time to show that you care. And Stephanie, your example is really, really powerful. So I hope that's a takeaway for many people. I know it is for me.
I actually think we talk about relationships today. I think this was really helpful in talking to other people from other professions as well, and hearing about, we're all facing very similar challenges. Yeah. I think that's part of the relationship building, of knowing that we're not alone. And it does make it a lot better of like, okay, well, obviously none of us all want to be burnt out, but knowing that, we're all trying to figure this out together, we can all count on each other to understand how we're feeling. And, that's our support system right there. So it's pretty cool to be able to do that.
It's really interesting that you say that, Chaya, because one of the things that we heard loud and clear from our care teams across the board, not just our providers, and I focus on the provider wellness because I'm one myself, is that they felt incredibly lonely in their practice. That because of either COVID, or because there was so much of a time stretch, or because of the productivity requirements, they didn't feel like they had those collegial relationships that were really supporting them, and they didn't know how much they missed that. So one of our biggest initiatives is to make sure that we have places for these people to get together, and for our care teams to get together and experience and develop that. And it's been incredibly powerful and successful, and to watch. Right? Because all of you have talked about how you lean in and on each other. And it gets to be even more critical when it's not the boards anymore, right? When you have someone's life in your hands, and their livelihood. And so it's even more important then to have that sort of collegiality.
I really appreciate what you said, because you all inspire me so much. You all are the future of healthcare. You're the ones who are going to help us to change the system and change what it is that is not working for the providers, for the caregivers, and for the patients. When I started out in medicine, we didn't have people like Stephanie that were providing, doing provider support. And the fact that there is a role like that now, and that people are starting to really think about that and move in that direction, it just shows how important that is, and how we really need to do something that's different.
And just to follow on with that, Stacy, one of the things that I frequently hear from providers that are struggling, either with burnout, work-life rhythm, and also from care teams, like we don't function in a vacuum, is that there's this almost learned helplessness. I can't do anything about it. It's too big. It's the system. It's it's bigger than me. I have no control, and all of those things, and when taken together, are correct. But there are places, again, I characterized this as microaggressions, something we typically apply to prejudices and discriminations. But they're small insults every day, and if you can identify that small insult that you can fix, you can really help to allay that state of burnout. And so I guess I'm just really excited because you guys are so much more aware than we were when we were in school. And you can actually work to address those things in the small ways wherever you find them, because those small ways have such huge, huge impact. And you can teach something to your elders like us. Maybe we'll learn too.
We actually shared something. I'm Emanuele, a first-year medical student here at Unicom. And in our group, we were talking about how it's important to take time to do things that you love, even if it's 10, 15 minutes, because that just brings you back. And sometimes it regrounds you, and it's just important. Just like a routine, if you focus on, changing the oil of your car, keeping up with the tires, you're always going to run more efficient, more smooth when you do have to run, versus sometimes we focus, I have to do this, I have to do that. I don't have time to do stuff that I love, but then we're less efficient and then we're going towards the burnout. So if we take the smaller time to do the things we love, we keep up. And just like you mentioned about the insult, I love that. I wrote that down. To take care of those things. Thank you.
Thank you for sharing that. It makes me think of a physician who I worked with, and every day before he started his day, he did a very short meditation. It was very short. It was only a few minutes, but he made sure to take the time so that he could feel centered and grounded before he started his day with patients, because he didn't want to bring his stuff into the room with the patient. He wanted it to be about the patient. And I said, how do you make time every day to do that? And he looked at me and he said, how do you have pants on? And I was like, excuse me? And he said, how do you have pants on? And I said, well, I can't come to your office without pants on. And he said, yes, you need to make this as important as putting pants on. And that has stuck with me. Like, whatever your practice is, make it as important as putting pants.
And, it's also interesting, sort of going back to something that Dr. SPT said earlier, is, wellness is only prioritized if we prioritize it. It doesn't just happen. It doesn't happen to you. I mean, there's all sorts of things that'll get in the way. And when we first did this program last year, this is our second year, we actually had to talk to our students and say, hey, no, this is part of your learning. This is as important, if not more important to you than, the next shelf exam. Spare some time on the shelf, some points on the shelf exam, pass it by all means, because otherwise it's badness. But I mean, it is important. It is as important as anything that you will do in patient care, and intensely satisfying. And there was pushback at the beginning, right? Because it doesn't fit into the normal mold of things. But by the end, we had a beautiful, I would almost call it a family of last year's cohort that was supportive and really couldn't have imagined the year without it. So definitely worth investing in.
There's a question in the chat about whether the program that you've done with Unicom will be expanded to other professions, and a follow-up says that would be super exciting.
That would be my dream. I would love that. So now,
but then we would have disclosures, Stacy, and that's more stuff in the slides.
It's some disclosures. That'd be great. Yeah, so we have a resiliency and leadership program that students are selected for, and we take about 10 students per year within COM, and so there's about 40 students throughout all 4 years, and they do work throughout all 4 years, and that's something that I think in the future might be able to be done interprofessionally. And then there's the program that we're doing with SMHC, which is for third-year students specifically. So I think there's lots of options and interest in developing this further.
The other thing is that we presented recently at Fall Caucus to all of the individuals that are heading up programs around the area. And one of the questions we got is, oh, with everything, how do you do it? And again, the answer was you prioritize it. So I'm actually fairly excited to see if that will be expanding to other sites as well.
Well, if there's no other questions, I have a question. So one of the things I've heard in our group, and I've also heard in other places, is that you kind of either have empathy or you don't, and that it's something you bring to your work with your patients and clients. I'm wondering, listening to the programs that the two of you are doing, can empathy and compassion be something that's taught or reinforced in health curriculum?
Yeah. I mean, lots of good evidence in the Compassionomics book. They have a whole chapter on how you can learn to be more compassionate. And maybe it's not even be more compassionate. I feel like those of us who go into the practice of taking care of people already bring with us the strong desire to help others. But maybe it's more of a way of how to communicate it and how to do it efficiently, as in the power 40 seconds. And it's those little gestures that actually don't take that much time that can relay so much information to patients. And yeah, there's a lot of evidence that empathy and compassion can be practiced and better utilized with our patients.
I second what Stacy says there. I think it's something that we have. Otherwise, you wouldn't make it through these demanding programs, right? You've got a goal. And I start from the place that healthcare, for the most part, is a calling. And then somehow along the way, again, going back to systems approaches, we turn it into piecework. So it's not so much developing empathy, it's finding it again. And finding it in a way that you can incorporate on a daily basis and putting your pants on. It's what we do. It's rediscovering it in yourself. And depending on where people are on burnout continuums, that can take longer or less time, but always prioritizing it because you feel better. You just feel better when you're helping other people feel better.
And I think we prioritize the science and we prioritize studies, and as we should, we are scientific people. And also that was why they wrote the book Compassionomics. They were like, there is a lot of data and meta-analyses, so much so that they actually stated in their book that not practicing compassion is malpractice. The benefit of creating that relationship and showing compassion is more powerful than placebo and is just as powerful as the medications that we give. And so I think we need to hear that data just as much as we hear the scientific data and studies that we look at around disease prevention and cure.
And I'll also say that when we get comments from patients about what they remember from their interactions and how they felt about them, what they remember is that my provider sat down and we've timed it. We literally sit down with people for 5 minutes at a time, right? They held my hand. They told me it was going to be okay. They explained things in a manner that I could understand. You know what they didn't do? They didn't talk about the anominative bone in the hip, which was a crossword puzzle question last night, nor did they expound upon our evidence-based medicine wizziness, right? It was the fact that we treated them as humans first and foremost. And honestly, even when we start to get into issues of mistakes that we make and malpractice, when we've developed those relationships with our patients, they give us grace back too. And that's really important. They give us grace when we can't even give ourselves grace.
So this reminds me of the very famous Maya Angelou quote, which is, people don't remember what you do or what you say. They remember how they make you feel. And I think that is an adage of the work that we do. We all need to be wearing our pants. And when we enter our patient and client's room, bring your compassion with you.
I agree. And thank you, Chris. I was going to ask if we could go to the slide that just had the books. Yeah, thank you very much. So if you want to know what books we had our students read, these were the books that we purchased for our third-year students and had them read and review. So Crucial Conversations, learning about how to have difficult conversations and feedback. Grit, the power of persuasion and perseverance, and the contrast of that, Quit, the power of knowing when to walk away, by Annie Duke. Super interesting. She's a professional poker player. Really appreciated that book. Range, Why Generalists Triumph in a Specialized World, by David Epstein. And then The 6 Types of Working Genius. And again, another way to know and understand yourself and how you work in the world, and understand why we're not all the same and why we do things differently. So I would highly recommend some of those as good reads to help you along your way.
Well, I can't thank the two of you enough. I wish could we all do a clap. This was amazing and really beneficial. And we're going to continue this conversation next Wednesday in person on the Biddeford campus in the Rippich Commons room 320. I hope some of you will come and bring your friends. Bring folks who you think will really resonate with this conversation. And we will have snacks, as Michelle likes to remind us. So because it is at a lunchtime, we will have some food there for you as well. Our next event is our student showcase, and that is on December 6th. And we hope that some of you will join us then as well. So thank you so much for a very enriching hour and a half. It went by like that. And thank you everyone for participating so actively. We really appreciate it. Thank you.